Okay, so the question is, how do I avoid Ozempic face, Ozempic butt? First of all, the fact that those terms are in widespread use is still really funny to me. But Ozempic face, Ozempic butt, the same kind of question of does Ozempic cause crepey skin or not? No. Weight loss can result in kind of a hollowed, shallow look of your face or a flat butt, and that would be Ozempic butt or Ozempic face. A lot of times it's just you lost a lot of weight. Now, I do think it should be noted that your body will kind of mitigate the damage of some of that. If you rapidly lose some weight, you will lose it from the areas that are easiest to burn first. Your body will counterbalance that over time and kind of redistribute your body fat. But there's some really easy ways to cheat towards maintaining higher growth hormone levels, meaning resulting in increased IGF-1 levels that will help maintain your muscle mass. So it's not that Ozempic butt means you lost all your muscle mass from your glute. That's not true. It's way more likely that if you starve yourself or you're not or you're losing weight inappropriately, that you lose muscle mass. The GLP-1 agonists should help change your insulin resistance so that if you maintain a protein, fat-heavy diet and try to stay away from sugars, that you can maintain more muscle mass. But there are some really simple, easy peptide therapies, which remember, Ozempic, semaglutide, Mounjaro, tirzepatide, are both peptides, GLP-1 agonists. There's 13 of those in the human body. These are the 2 of the 3 that have turned into drug therapy. That's primarily indicated for diabetes or insulin resistance. The tirzepatide, or the Ozempic face, Ozempic butt, is mostly about rapid weight loss and trying to maintain some muscle mass. Do I think unopposed growth hormone is a good idea? Absolutely not. Number one, it's a felony. So we would never write a patient for growth hormone. But can you write for growth hormone releasing hormones or growth hormone releasing peptides, right? GHRP or GHRH. Yes, because even though the FDA banned, and when we say the FDA banned, I still haven't really figured out what that means, because it didn't shut down compounders that make it through some of the research labs we use. It didn't make it criminal to help a patient get that or to prescribe it. They banned it not because they're not effective, not because they haven't been around for decades. They banned it for the potential for contamination in bulk source components. That's what's in their FDA letter. We went through a whole episode on that on the podcast. But the use of ipamorelin, sermorelin, and CJC 1295 can dramatically mitigate those symptoms of rapid weight loss and the difficulty that you may have maintaining some of your muscle mass when you're losing weight. And I think that because the downside of ipamorelin CJC, which is using a growth hormone releasing hormone and a growth hormone releasing peptide together, the downside of that is very minimal, and the upside of that has been fairly significant because they are very synergistic and can help the patient when the cost of either one of those by themselves or together is about the same. I think the cost to the patient and the benefit ratio of that is dramatically tilted in the patient's side, and it's really been a nice way to kind of mitigate the side effect of rapid weight loss. So when you talk about Ozempic face and Ozempic butt, it's not Ozempic face and Ozempic butt. It's the side effect of rapid weight loss. The benefits of rapid weight loss are pretty easy to identify. The side effects maybe not as easy to identify because not everyone that loses weight fast gets Ozempic face or Ozempic butt. But if you're having trouble maintaining muscle mass, there are a lot of simple, easy steps. Some of the peptide therapies with ipamorelin, CJC 1295, sermorelin, that have been used in a lot of clinics all over the world to help patients mitigate the stream when it comes to the side effect profile of rapid weight loss. This is brought to you by the Zero Downside Podcast. I'm Dr. Wade McKenna. As always, we're brought to you by moabtexas.com. Please hit the like and subscribe button. I appreciate your attention. Thank you.